In other national news, India has renewed its focus on Covid-19 in wake of a fresh outbreak considered to be the worst in 3 years of the pandemic in China and in several other countries. The centre has urged citizens to follow Covid-appropriate behaviour and maintain physical distance. Sources say the next 40 days are going to be crucial as India is seeing a surge in neighbouring China. However, Health Ministry sources also say that there is nothing to indicate that there would be a rise in hospitalization in case infections spike in India. Central government sources have also indicated that there is no plan to bring back the mask mandate. The government will focus on COVID awareness instead. Reports indicate that Health Minister Mansukh Mandavia is likely to go to Delhi IGI airport on Thursday to oversee the testing facilities for international travellers.
तो ये लोगों को समझना चाहिए कि वैक्सीन्स का जो बेनिफिट मिलता है सीवियरिटी और डेथ को कम करता है 80 to 90%, इन्फेक्शन को रोकने में कारगर नहीं है। तो किसी भी वैक्सीनेशन स्टेटस के बाद वेव आएगी और वो आई, चाहे वो चाइना में आए 300 करोड़ से ज़्यादा वैक्सीन लगाने के बाद भी, चाहे 3 डोज लगाने के बाद भी जापान में आई, तो वह आएगी, लेकिन उसका इम्पैक्ट होता है कम होगा, क्योंकि वहाँ पे कभी भी बहुत बड़ी वेव नहीं आई थी इन सारी कंट्रीज़ में। चाइना में सिर्फ वुहान में आई थी, तो बहुत एविडेंस जनरेट हो चुका है। इसलिए वे अनलाइकली है कि बहुत ही ज़्यादा हॉस्पिटलाइजेशन और डेथ बढ़े कभी भी, चाहे वो जनवरी फरवरी में, नियर फ्यूचर में, अनलाइकली है।
Mayank joining us live. Mayank, once again, we are in a situation where we need to tread cautiously, and that's precisely what the Health Ministry has said, that the next 40 days will be crucial. On what basis, on what grounds are these 40 days so crucial, Mayank?
See, Afrida, after, the cases had started to rise in China and other countries such as Japan and South Korea, the Ministry of Health and Family Welfare and the officials in the ministry did an analysis of, how the cases go from one part of the world to another. And in that analysis, internal analysis by the Health Ministry, there they found out, that the first case in 10 days from the start in the Asia Pacific, it moves to Europe and then to Americas, and then it comes back to the Pacific Islands country, and then it comes to India. So on that, on that analysis, on the basis of that analysis, the Health Ministry officials has said that, next 30 to 40 days will be very critical for India's fight against the next wave of COVID pandemic. In fact, the Health Ministry is also saying that although the cases might go up because the R naught, the coefficient of infection factor of the BF.7 subvariant of Omicron, which is causing havoc in China, so it has very high infectious number, because one individual who is already infected with COVID, this subvariant of COVID, so that person can infect 16%, but the rate of hospitalization will be very less in India, and that's what the Ministry of Health is hoping for because of the wider immunization coverage. And what we are also learning is that there have been testing ramped up at at the international airports. There have been as many as 6,000 tests conducted in the last 48 hours. 38 of them have been tested positive for the BF.7 variant, and those were, those samples have been collected and the virus has been isolated. And what we are also learning from the Health Ministry sources, that the scientists of the country are trying to test the efficacy of the indigenous vaccine and the drug that the doctors were using in the earlier waves of the pandemic on the BF.7 variant, to understand how much is the efficacy and how can India make better plans and policy regarding the, if at all there has to be another surge of COVID-19 pandemic in the country, on the lines that we saw last year.
Yes, absolutely. These are important points that you're sharing with us, Mayank. Thanks very much for giving us the latest.